Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Julia Townsend, and Carlos Saracedo is interpreting this press conference in Spanish. This interpretation will be available on the county's website and YouTube page shortly after we conclude this press conference. This has been another very difficult week. Positive COVID-19 cases are rising significantly across all parts of Santa Barbara County, California, and the nation. Since our last press conference, positive COVID-19 cases in Santa Barbara County have risen 18%. Fortunately, active cases decreased slightly by 4%. COVID-19 positive patients admitted to local hospitals increased this past week from 64 to 80, which is a very significant 25% increase. The total hospital bed occupancy rate, including non-COVID patients, is now near 50%. COVID-19 positive case patients currently being treated in intensive care units of our local hospitals also increased by 15% in 1 week. When combined with non-COVID-19 patients, the total intensive care utilization at our local hospitals is now at 56%. This is very concerning because hospitalized COVID patients often quickly require more intensive treatment with very little advance warning. Maintaining available surge capacity for ICU beds is very important. What do all these numbers tell us? The most important takeaway is the virus is very active in our community right now. When we were all sheltering at home and businesses were closed, the virus was not easily transmitted from person to person. Since the reopening of many businesses in early June, more people are mixing and the virus is being transmitted invisibly throughout the community. The most important question is, what can we do about it? The answer starts with our own personal responsibility. Each of us must do more to protect ourselves, our loved ones, and our neighbors from contracting the virus. Some people believe it's inevitable they will get the virus and it won't be a big deal because they're young or healthy. That may be true for some. Many people have contracted the virus and only had a very mild reaction. Unfortunately, a mild reaction to the virus isn't necessarily always the end of the story. An asymptomatic person can unknowingly pass the virus on to someone who then may face life-threatening disease or permanent organ damage. Being young or healthy also does not automatically make you immune to very serious and even potentially life-threatening medical complications from COVID-19. New longer-term research indicates patients who've contracted the virus may continue to suffer from serious medical complications that are not completely understood. COVID-19 is not the seasonal flu. You don't want to get it just to get it over with. So what can each of us do specifically to help stop the spread of the virus and protect ourselves? Ask yourself these simple questions. How many times have I washed my hands today? Do I have masks at home, work, and the car, so I'm always prepared to wear a face covering when I could be within 6 feet of another person? Am I still regularly disinfecting surfaces? Am I limiting my indoor contacts with other people who don't live in my home? Take these questions seriously and think hard about what each of us are doing in our own lives to give us the best chance to stop the spread of the virus. This is not easy. I've found myself getting complacent about hand washing as time has gone on. I'm trying again harder to wash my hands every few hours. I almost forgot my mask when I planned to walk outdoors in my neighborhood the other day. When I went outside, I felt strangely exposed and went back inside to get my mask. I'm taking this seriously and paying special attention to the details again because it's our best and frankly only defense. I hope each of you does too. I know it is frustrating to be diligent and respectful and concerned and then see other people ignoring the simple request to wear face coverings. It feels extraordinarily unfair. I find myself asking, how can they be so irresponsible? I strongly believe we're all going to get through this together by modeling proper behavior and setting the best possible example. It isn't helpful to be consumed by what other people are doing. It is increasingly clear COVID-19 isn't going away soon. I've come to the sober realization we have to adapt and be resilient to all the changes we are experiencing because we will be facing this pandemic for a longer period of time than we had all initially hoped. This is not a sprint, it's a marathon and perhaps even an ultra-marathon. We all need to focus on building a lifestyle that is sustainable and fulfilling despite the necessity to wear masks, wash hands, and avoid close contact with other people. If you're concerned about local businesses surviving, if you're concerned about protecting your friends and family, if you're concerned about the impact these events are having on our community well-being, please wear a mask and stay 6 feet away from other people. We'll now hear from Dr. Vaughn de Reynoso, the county's public health director.
Thank you. Good afternoon. Today, we are reporting 75 new cases in our county. 90% of our cases are considered fully recovered. 345 cases are currently active. Unfortunately, we are also reporting 2 additional deaths. These individuals were in their 70s and in the Santa Maria area. We will include the details in our press release after the press conference. In looking at the total number of cases, we're seeing a 42% increase in just the last 2 weeks. Of the cases that we've investigated, 57% are from person-to-person contact. 42% are from community spread, which means that the cases are not sure how or where they became infected. Our epidemiology team looked closely at our contact tracing reports to better understand the exposures that have occurred since July 1st. Of those that we have details from in the past 10 days, many are identifying exposure to close contacts such as parents, close friends, people they work closely with, and roommates. Community exposures that were identified include family gatherings, Father's Day gathering, and 4th of July parties, funeral services, church services, jail, and bars. We are reporting 75 cases are hospitalized with 23 in the ICU. As Supervisor Hart mentioned, we need to work together to decrease COVID-19 infections in our county. As I've shared, 99% of our cases became infected from close contact with a known case or exposed to a case in the community. This means that you must assume that everyone you come into contact with may be infectious. Therefore, I urge everyone to commit to doing 3 things. Wash your hands frequently, maintain your physical distance, and wear your face covering. Because an outbreak anywhere is an outbreak everywhere. Thank you.
Thank you, Dr. de Reynoso. Next, we have Nick Clay, the county's emergency services manager.
Thank you, Supervisor Hart. Good afternoon. Today, I would like to speak about the county's state-run testing sites in Santa Maria, Buellton, and Santa Barbara. As we mentioned 2 weeks ago, we have shifted our message on community testing to ensure we have access to those who need it most. The community testing sites have really 2 main purposes. 1, to ensure community access to testing, and 2, to find the disease. In order to ensure the community has access to testing, we have heavily promoted the broad use of these sites. This has resulted in the sites being booked to capacity with no immediate availability. Consequently, we are seeing a trend of high number of missed appointments. This is incredibly frustrating, as we are unable to test those who are at risk because the appointments are not immediately available. This issue, combined with the rise of cases, prompted us to adjust our messaging several weeks ago, from a want to get tested model to a need to get tested message. We are asking that those that want to be tested to defer testing at this time, allowing those that need to be tested the opportunity to do so. In the future, we may continue to adjust our messaging as the situation of COVID-19 evolves. We are asking for your support, patience, and cooperation as we adjust the dynamic challenges of community testing. So how can you help? First and foremost, please adhere to all you've heard today with local state guidelines with regard to your safety and your community's health and safety. Don't engage in high-risk behaviors. such as attending parties or other large gatherings, reduce your outings to those that are essential. Wear a face covering in public, practice social distancing, and wash your hands. Most importantly, if you do not feel well, please stay home and even from work. By following these steps, you are reducing your risk of catching and spreading COVID-19, most importantly, reducing your risk of needing a test. You are also helping your community by slowing the spread of COVID-19 and moving closer to easing some of these restrictions. If you have made an appointment at our community testing site and for any reason cannot make that appointment, please cancel. Again, if you have made an appointment at a community testing site and are unable to make it for any reason, please cancel that appointment so that others may use that slot for those who need testing. If you're considering getting a COVID-19 test, there are some things we'd ask you to consider. First, do you work in a high-risk environment where you have frequent interaction with the public? Do you live or work in a congregate setting, like a licensed care facility or shelter? Are you an essential worker, public service, utility worker, grocery store, etc.? Has a healthcare provider or public health professional advised you to get tested? Have you had close contact with a person confirmed with COVID-19? And to be clear, close contact is not a passing in the grocery store. It requires 4 elements to have a close contact, all of which must be present. Contact for a duration of over 15 minutes, with a COVID positive individual when neither of you are wearing a face covering, that has occurred within 6 feet of each other in an enclosed space. Do you have symptoms of COVID-19? If you can answer yes to any of these questions, then you should consider being tested. The California Department of Public Health has directed labs to triage processing to those most at risk. We also want to caution that test results can be delayed regardless of an individual's priority. The state is working to solve this problem, and some improvement has been made. Availability of testing and the speed at which results are received are issues that are currently being experienced at many sites across the state. So, what do you do if you're at risk and you need to get tested but can't get an appointment? Well, as a reminder, if you've been able to reduce your risk by following state and local guidance and have not had an exposure, then you are at low risk and should defer your testing. However, if you are symptomatic, first and foremost, call your healthcare provider and seek guidance. They may direct you to not get tested, instead recommending you stay at home, and if you're able to care for yourself or have a family member care for you. We also encourage individuals without access to healthcare that may be eligible for our county's public health department healthcare centers to reach out and explore that option. Also, it is key to remember that free community testing sites are simply one piece of the testing puzzle. Healthcare providers, urgent care centers, community clinics, and even some pharmacies also provide testing. As always, we continue to advocate to follow state and local guidance. If you're interested in scheduling a testing appointment, there's a website to visit, www.lhi.care/COVID testing. www.lhi.care/COVID testing. The Public Health Department is actively exploring options to increase the testing capacity at many of our testing sites for those who are at risk. As this picture becomes more clear, we will share those details with the public. I'd like to close with a final comment on testing. A nasal swab test for the virus is simply a point-in-time test. It simply states that right here and right now, whether or not you have coronavirus. A negative result is not a hall pass that allows us to engage in behavior that would put ourselves or others at risk. A negative result should not put you at instant ease. A negative result means that at this moment in time, you do not have coronavirus, and that can always change. Testing is a tool used by the healthcare system, and it's a critical tool, but it is not the whole solution. The most powerful instrument in our fight against COVID-19 is each and every one of us. Our actions today, more than ever, are less about ourselves. Our actions today have a dramatic impact on our community, so please follow the guidelines that have been laid out, not only for yourself, but for those around you. Thank you.
Thank you, Mr. Clay. I'm also very pleased that Dr. Stuart Comer is able to join us today. Dr. Comer is the lab director for the Santa Barbara County Public Health Department.
Thank you, Supervisor Hart. Good afternoon, and I just want to talk about a few items. You heard Director Reynoso talk about literally the issues that are facing the county, and you begin to realize, how much and how difficult now the testing environment has become because of so many more positive cases. So to just give you an example, 1 month ago, we did, basically, we had, in the entire county, we did 24,000 tests. 2 weeks ago, we did 37,000 tests, so that's an increase of about 13,000. As of yesterday, or actually today, we're over 54,000 tests that have been accomplished. And so you look at that increase and you begin to realize that that's a 50% increase. So not only are we increasing the number of tests significantly, but the rate of increase is increasing. And when you heard what Nick had talked about, and he's absolutely right, the difficulty we have is literally trying to maintain a match between capacity and the numbers of patients that are positive, and that rate increases dramatically. You look at what we have used in the past. We've used the largest 2 reference labs in the nation, and one of the largest regional labs, actually probably the 3rd or 4th largest in the nation. And their turnaround time, one of the turnaround times used to be about less than 24 hours 2 weeks ago. Now it's 3 days. The 2 largest labs in the nation now have gone anywhere from 3 to 6 days of turnaround, some days 7. And I know that's a tremendous frustration for a lot of the individuals that are in the county, because remember, one of the things that has occurred since we started is we've brought back elective surgeries. And I think one of the things that's important, and Dr. Ansorg realized this, we had to open back up some of the hospitals because elective surgeries that were elective months ago really are not now. So it's extremely important to a lot of our residents in the county. And so that has to be part and parcel of the equation of individuals that have to get tested, because all 3 of the hospital systems, the 5 hospitals in Santa Barbara County, all of them are testing their patients before they come in. We cannot risk having more healthcare workers become infected, because then you lose the ability to have healthcare workers, and that's one of the problems to some degree we're having with some of our nursing in all the 3 areas. And Director De Reynoso is very engaged with the CEOs of the hospital systems, because again, that's extremely important to maintain that. In that regard, one of the things that Nick pointed out is, when you look at the front page of the paper, you begin to realize that, all the things that we've had in the past now are all booked up for weeks. So other areas have come in. Community health clinics, the hospital systems, both Marion and Cottage, have increased their capacities to try to improve the numbers of patients that can come in and be tested. Again, everybody, and we're running these days 7 days a week, and the difficulty again is the numbers of patients that need to come in that are both pre-surgery patients, which are extremely important, and obviously symptomatic patients. And so we are going to continue to do that. And so Nick and the public health department is going to create, as best we can, increased capacity. We just have to determine how that will happen. But I will tell you, I think a good portion, you look at some of the urgent cares, I work, a lot of the urgent care medical directors call me, and it's very encouraging, because you see urgent care directors that literally 3 months ago were doing 1 or 2 or 3, swabs for their own patients. This one group that he operates 3 different urgent cares in Santa Barbara, he did 200 a week ago, 200 swabs between the 3 urgent cares. In that regard, Nick and the director have been very helpful, because they just opened up a lot more of the swab allocations that they have received from the state, and now they're providing that now to urgent cares and to the community that is testing. So again, it's that public-private partnership that's exceedingly important. I know Supervisor Hart has talked about that and is a very strong proponent of that, because we haven't even talked about how we're going to handle the schools as they try to come back. We're still trying to handle patients. So having said that, I just will probably leave it at there and just say we really do want to say thank you for all that you're doing. I know this is, Supervisor Hart is right. We really have gotten into ultra marathon, and sometimes that pace is fast, and this is one of those times where it's fast, and we just have to help each other out to try to mitigate the circumstances whereby more and more patients are becoming positive. So thank you for your time.
Thank you, Dr. Comer. We'll now go to questions from the room. Mr. Devine.
Obviously, we began this pandemic staying at home to flatten the curve, to buy time for the hospitals and public health to prepare for a surge in cases, but most stayed at home and the curve was flattened. Since then, we've reopened and the cases have gone up. Dr. Ansorg had previously said hospital beds are quickly filling up and the state is shut down. Some sectors have modified their services. So I'm wondering what was done in the last few months to prepare for this moment, and are we ready for the hospitals to be reaching their capacity?
So So I can take a stab at that. What's different now is that we have more PPEs. We are prepared. The ventilators, if you recall early on in the pandemic, there was a lot of community worries about, do we have enough ventilators? And I can say that as of today, even though we have 75 cases in the hospital, and even though there's about a 31 to 35% capacity in the hospital beds, we have 75% of ventilators available. So that's what's different, that the hospitals are prepared and that public health infrastructure is better prepared. We have adequate PPEs that we stand by ready to deploy to our healthcare system partners.
Recently, we've obviously heard about the airborne spread of the virus, but today you guys spoke heavily about washing your hands. We haven't heard that message in a while. Why today is it more important than ever to consistently wash your hands?
One of the doctors probably is better.
I think that, like Supervisor Hart said, we've gotten complacent. It's the message that we've been harping all along, and we all have gotten complacent. We're 4 months into the pandemic, so it's a reminder. Until we have a vaccine, our cases are going up. What can we do to prevent it? And it is by washing our hands, not touching our face, along with wearing our face covering and observing the social distance.
Lastly, for me, you mentioned 54,000. Was that the total that have been tested throughout the whole pandemic?
Yes, that is correct. And you know, you begin to look at that. When we started, we were lucky to be able to do 4 a day. And so now we're literally between, I called Marion today, and between Marion and PDL, we're testing over 1,100 patients. That includes what we send out. And so you begin to appreciate how rapidly that has expanded. And when you begin to realize that if you add every county in the state of California and then the entire nation, you begin to realize that even the national reference labs that used to be able to handle it still can't keep up with it. And what's happening is the supply. The supply chain is tremendously strained. And so literally when people would get reagents, and talking to Marion today, they basically have been very helpful to the county in doing that, as is PDL. But they go to their vendors, and what was supposed to have been delivered a week ago now has been delayed by 2 weeks, 3 weeks, et cetera. That happened also with the swabs. That's why we are very grateful for the county to have done that foresight and obtain that from the state early on through FEMA. So now that we can now release them and not at least make that a limiting or constrained resource for doing the testing. So now what we're really stuck with is you know, how long are you willing to wait? 6, 7 days it's there. I think the concern there is for certain, when we have outbreaks, that we have to know answers quickly, and when we have pre-op, that's where even our resources are constrained. And so that's where we're focusing some of our attentions. How can we get more intrinsic capacity to test within 48 hours or less within the confines of the county?
Thank you.
Thank you.
Thank you, Mr. Devine.
Just a quick question about masks and in public. I was on State Street the other day, and it's about 50-50 of people wearing masks and not wearing masks. At what point is the city or the county going to start issuing fines? I mean, it seems our counts are going up. It's been proven the masks help stop the spread, so why not start doing that? Because we allow hotels and everything, and half the people, or most of the people down there, are from out of town. So what are we going to do?
Well, we're consistently telling folks to wear masks. I think there was initially some confusion about, you know, do you need to wear a mask outdoors? I think it's clear now, it's better if folks wear masks when they're around people. If you're close to somebody, indoors or outdoors, it's a better, safer process and practice to wear a mask. So we're communicating that, trying to be really clear about that. We're also working directly with the businesses that folks have complained about, who said there are issues with proximity of patrons in particular businesses. And the county council has been working toward doing cease and desist letters with businesses that continuously, egregiously violate those standards. There's collaboration going on with the other local governments in the county at that level between city attorneys and county council to develop that tool and go at it in that way. But we're not ultimately going to enforce our way out of this problem. We're going to encourage people to do the right thing. That is how we are going to be successful as a community, is by modeling the right behavior and encouraging people to look out for themselves, their family, friends, and neighbors, and do the right thing.
Yeah, but when you have 3,000 or 4,000 people coming up from LA or down from San Francisco every weekend, and half of them don't wear masks, like that puts everybody in the community at risk. Why not start enforcing it? Because the police don't seem to think that they're enforcing it. The guys that walk around in red shirts downtown said they're not enforcing it really. They ask people nicely, but not always, like, people aren't cooperative. So, you know, those 3,000 people a weekend coming here, putting everybody at risk, and it, I mean, as a local, like, I'm not going to State Street on the weekend because it's not worth it. It's too risky. But I expect the county and the city to do something to stop that, you know, to allow locals to be able to feel comfortable going out in their own city.
Well, the mask orders used to be city by city and county by county. They're now the state order everywhere. So people who are coming to Santa Barbara from other communities are coming from communities where masks are mandatory too. And so the message to them visiting our community is the rules are the same here as they are where you live. There's no difference. We expect the same behavior, and that's what we're shooting for, is the residents to understand that and visitors to understand that and practice that.
Yeah, but without somebody on State Street enforcing that, I mean, a lot of people from out of town aren't going to listen to that. That's what I'm saying.
Next, we'll go to questions from the phone.
Yes, we have several in the queue. First up, we're going to Annika Abbott with KCOY KEYT.
Yes, thank you. I have a couple of questions, and I know you've talked a little bit more about mask enforcement, but I'd like if you could go into greater detail about how businesses and government are able to enforce mask wearing.
I think we just answered that question.
Okay. All right. Well, as far as mask wearing goes, I know you've been talking with different cities and with city attorneys, but is there any timeline that you have as far as enforcement goes for any cities in Santa Barbara County?
We are actively working with our other local government partners to increase outreach to businesses, to educate businesses, and to encourage their cooperation. And if there are egregious examples of uncooperative businesses, there will be consequences, legal consequences to those businesses. And we're going to continue to message and explain and urge and plead with residents and visitors alike to wear masks and take care of all of us together.
Okay. If people are not wearing masks, what do you see the consequences of that being in greater detail in the immediate future?
Well, the outcome is that we're going to continue to have a problem with coronavirus in our community. The virus will spread, and we will put all of the jobs and businesses that have opened at jeopardy. The governor has spoken about that clearly. It's up to each of us, wherever we live in the state. We're all interconnected. There is travel between regions of the state, and we need people to pay attention and heed this message and act on it.
Thank you.
Thank you.
Next up, we have Malia Martin with Santa Maria Sun, and Laura Place with Santa Maria Times will follow Malia.
Hi, so with it taking more time now for people to get their test results back, are you concerned at all that this will increase community spread as people who might be infected won't find out until sometime after they are tested?
So we do provide guidance for everyone who receives a test to quarantine at home if they are concerned that they have COVID-19. Certainly if any one of those high-risk groups, we encourage them to quarantine. But if someone's concerned enough to be getting a COVID-19 test, then they should be concerned enough to be quarantining at home to reduce the spread of COVID-19.
Thank you. And does the difficult testing environment, or do you believe the difficult testing environment skews our numbers at all?
I'm not sure we understand what you mean by difficult testing environment.
the fact that it's difficult for, I suppose, everyone who wants the want versus need of getting a test, the fact that people don't get the results for a while after they get the test, does it skew the numbers, the reality of the numbers in the county at all?
I think we do, 7-day and 14-day trailing averages. It could make a difference by a matter of a few days, but not much more by a few days, because that information is automatically fed through lab interface to the county from the labs that are testing. So other than a few day different, that's the only difference you would see in terms of not having the appropriate information to understand what the actual prevalence is. We do know that the prevalence has increased, especially if you look at clinics like Santa Barbara Neighborhood Clinics and or the Sansum, who have relatively set clinic groups, and they know that at this point their increase has gone to about 9%. So what's interesting is that we have very good sense breaking down the data to the different groups of what the prevalence is in the county.
Thank you.
Thank you.
Thank you, Ms. Martin.
After Laura Place, Tom Bolton and Tyler Hayden will be on deck. Laura, your mic is open.
Thank you. My question is for Dr.
Laura, your audio is not coming through. Do you have more than one device on by chance? You have feedback.
No, I do not. Hold on one second.
Maybe we can come back to Laura and see if the...
Can you hear me now?
It's an echo.
Okay. Yeah, come back to me.
Thank you. Going to Tom Bolton with Newshawk.
Thank you. My question, I guess, is for one of the doctors. And as we look at the hospitalization and ICU numbers, I'm wondering if you can tell us, where's the tipping point? At what point do we have to start taking more significant actions to stem that rise, whether it's closing things down or what? Can you give us some sense of that?
Yes, I can start. We know that we have 75 cases of hospitalizations due to COVID-19. So within the hospital system, there is 720 beds across our 5 hospitals. So the hospitals would look at their capacity and reduce the number of electives that they are booking. So earlier in the week, we had a conversation with the hospital CEOs, and one of the hospitals did share that. Looking at the numbers, they want to make sure that they have the capacity to, for any surges in patients with COVID needing hospitalization, so they voluntarily reduce the elective surgeries. And so I imagine that will be similarly with the other hospitals as well. That's one way that we can manage the hospital capacity. But again, as of today, we have about a 31% capacity, and that doesn't really tap into the surge capacity that the hospitals have as well.
Okay, so right now at a roughly 50% capacity, where you're looking at that kind of a strategy, but at what point do you have to get more aggressive?
I'm not sure what you mean by more aggressive.
I mean, right now, we're not changing what's open or those kinds of things, but I would assume at a certain point, if the numbers continue to rise, you would have to take more severe, have new health orders, et cetera. And I guess I'm just trying to get a sense of what percent of capacity would trigger that.
Absolutely. So when we think about further closures, it's not done in a vacuum. It's done in partnership discussion with our hospital system as well as with our state. As you are aware, we have been on the state monitoring list for the last 26 days. So that's a constant conversation with the state and the state's guidance about further closures. We have taken action per state mandate and closed many indoor operations to decrease the number of close contacts and to be protective of both business and the community's need to participate in day-to-day life events. And so it's a balanced conversation between the state, our local healthcare system, and our policymakers, and driven by data. And so that conversation is currently taking place on a daily basis and on a weekly basis. We look at the number of cases, we look at our positivity rate, we look at the hospital capacity, and have developed several models, and again, in consultation with the state.
All right, thank you very much.
Thank you, Mr. Bolton.
And now, Laura, since we had audio issues for Laura, she has sent the question to me to read. This is for Dr. Von Dorenoso. Can you clarify specifically what improvements you want to see in Santa Maria regarding enforcement? Are you asking for more citations of businesses, et cetera?
So earlier in the week, the county presented our demographic study to the city council, and we recommended two things. One of it is close coordination of all the different outreaches and different prevention strategies in the community. So right now, the county is conducting health education campaigns, as other community agencies, and I think as well as the city. And so it's coordination of those services so that we can amplify that piece. With regards to education/enforcement, we shared with the city the legal code that allowed the city to take enforcement action. And as Supervisor Hart mentioned earlier, it's not always necessarily a fine or punitive, but it's cease and desist letters, monitoring businesses that are not in compliance with the governor's safe opening guidelines. And it's really partnership to make sure that both the residents and the businesses have everything that they need to create that safe environment for the employees as well as for the residents. So those are some of the strategies that we have put forth, and look forward to forming that county, city, community partnership in the days ahead.
Thank you, Vaughn. Next up, we're going to Tyler Hayden with the Santa Barbara Independent, to be followed by Lance Orozco at KCLU Radio. Tyler, go ahead.
Hi, thanks. Thank you. I was wondering if you guys could expand a little more on those cease and desist letters. Do you have any figures of how many have been sent out, where they've gone, mainly more community-wise, not necessarily looking for actual locations, but just kind of a general scope and general location of where that's happening?
This is a new strategy that is going to be deployed soon. We're using the folks at Environmental Health to speak directly to the businesses and ask them to comply. And in the vast majority of instances, we're getting successful compliance from businesses. So this is a tool that will be used on repeat offenders who are consistently ignoring the recommendations of Environmental Health about how they should be more strictly adhering to the attestation procedures that they've agreed to. And so this is a tool that will be used going forward.
Do you have a sense of what types of businesses in general are violating these rules? Are we talking restaurants, barbershops? Does it run the gamut?
The businesses that I've heard specifically mentioned are restaurant-type operations. There have been a couple of restaurants that have continued to operate indoors, and those are, I think, the target right now.
Got it. Thank you.
Thank you, Tyler. Next up, we're going to Lance Orozco. Go ahead, Lance.
Hi there. Thanks for taking the time to take our questions today. And I'm not sure who this is for, but it's a general question. Just the problem that we've been seeing has been a lot of the spikes have been with the under 30 crowd. It's been a younger crowd. And unfortunately, I think a lot of those are folks that, they're not watching television news. They're not reading the papers or listening to the radio. How do you reach that younger crowd? Because the older crowd it seems like, a lot of them are, wearing the mask and doing the things, but the younger group isn't. So how do you reach them?
That's a great question. We noticed that as well. So our prevention strategies will be more focused towards that age group, and we will be using social media, different methods and different types of messaging that would be really well received in that age population. And so not only are we doing that for that age group, but we're also looking at how can we pivot our general health and prevention messaging to specific communities so that there's identification as well as adoption of those prevention strategies.
Is that all of your questions, Lance? Yes.
Thank you, Mr. Roscoe.
That wraps up our online questions.
Thank you. The Board of Supervisors will hear a presentation on COVID-19 at 9 a.m. on Tuesday. That meeting is viewable on County Television Channel 20 and the county's YouTube page. Our next press conference will be a week from today, next Friday at 4:30 p.m. If you have any questions, please call the county's call center line at 833-688-5551. I want to remind everyone to continue to practice these 3 simple steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. And number 3, if you feel sick, stay home and isolate yourself. If your symptoms worsen, call your doctor or medical provider and follow their advice. Please continue to be patient, considerate, kind, and safe. Please take personal responsibility for keeping yourself, your loved ones, and your neighbors safe. Please try to focus less on what other people are doing and focus on what you can do to model the best possible behavior. Thank you for joining us.